Hello again. Today we're going to talk about COVID-19, exactly the relevance of SMS cells to the treatment of that horrible disease. We would like to start, however, with describing what it means to have a serious or critical level COVID-19 as a patient. And for that, we have Dr. Schechter, Roger Schechter, who is not just a wound care specialist, but he is also an expert and a specialist in emergency medicine. Hello, Dr. Roger. Can you tell us more about what it means to have COVID-19 at a serious or critical level?
Dr. Rahmo, in general, patients who are becoming severely or critically ill with COVID-19 do so on average between about 7 and 10 days. Mm-hmm. And as they're becoming critically ill, in general, they tend to have difficulty breathing, low oxygen levels, and ultimately may require breathing tube placed, otherwise known as endotracheal intubation.
Uh-huh. Yeah, so these are symptoms related to the lung, mainly, to the function of the lung.
Yes.
Is that the whole story?
No,
yeah.
There's so much more.
Uh-huh.
Some of the people have low oxygen levels, not only because the virus is attacking their lung tissue, but there are two other factors. One is the overreaction of the immune system, also causing damage to the lung, mm-hmm. and fluid in the lung. And so this is on top of the destruction of lung cells by virus, mm-hmm. and on top of the general tissue destruction by the virus. Beyond that, patients can also develop a state in which their blood clots much more easily than normal. And small blood clots can actually block the microcirculation of the lungs such that people are unable to have normal oxygen exchange due to the death of some of these blood vessels.
Do we know the reason for these blood clots?
There's a lot of speculation, but nobody knows for sure. It is likely a manifestation of two things. Number one, the overaction of the immune system, possibly destroying some of the factors that prevent coagulation. And the other is that as there is tissue destruction on a fairly large scale, the exposure of underlying tissues can actually trigger the cascade of blood coagulation.
Do we know of the similar effects of other viruses causing also this kind of thrombosis?
Not very well known. There weren't enough patients in the initial SARS epidemic back in whenever it was, 2010 or 2013. During that, there may have been some blood clotting involved, which was also a coronavirus. Influenza can cause an overactive immune system response called a cytokine storm. It can also cause severe damage to the lungs such that they fill up with fluid, but there really isn't as much hypercoagulable state described in influenza type infection. This is potentially unique to SARS-CoV-2 or COVID-19 as it's been known.
Yeah, that's quite interesting. But I think you would agree that there are other organs that are also being attacked by the virus.
Oh, yeah.
Can you tell us more about that? Because some of these organs could decide whether you survive the disease or not. This is my impression, right?
Yes, well, second most affected organ is the heart. And again, it may be because of microcoagulation, blocking some of the blood supply to the heart itself.
Yeah.
It may be death of the muscle tissue from the virus, and it may also be the hyperimmune state attacking the heart muscle tissue. At this point, it's not very well characterized, but a lot of people can recover from the acute lung injury and appear to be convalescent or getting well, and then they suddenly plunge because either they have a cardiac arrhythmia and die, or they're unable to have sufficient heart muscle pumping, and therefore their lungs fill up with fluid again, and then they die.
I imagine that people who have already some heart issues would be even more susceptible to such an attack.
Well, likely. I mean, anyone with any underlying condition is more susceptible, but it's independent of their underlying cardiac history. Young people specifically have been shown to, who do go on and die, often have heart involvement.
Any other organs?
To a certain extent, the liver and kidneys can be affected. Any of the end organs, including the brain, can be affected.
Now, having the brain involved is really worrisome. I mean, not because we are intellectuals, but in general, I think having the potential of suffering in the future in terms of brain manifestation. What kind of manifestations are we talking about?
Well, in the brain, I mean, people have been known to have strokes. And again, that's likely because of the hypercoagulable state. But beyond that, there's brain inflammation, which is manifested after the virus is completely cleared from the people's system. People will still have what's called brain fog, which means that their thinking is impaired due to brain inflammation. Some people have visual problems, coordination, hearing problems. There's any one of a number of neurologic manifestations of post-COVID-19.
Yeah, so I mean, since we have this blood-brain barrier, I mean, that barrier will not hinder the virus of crossing that threshold, right?
No, because the virus is usually about 130 nanometers. And that means that the virus can cross between the junctions of cells or in the interstitium. And therefore, the blood-brain barrier is no barrier at all to the passage of the virus.
Now, you have also nerve systems, peripheral nerve system, that is quite important too. Do we know of any effects on the peripheral nerve system or on the spinal cord also?
I'm not so clear on that. I'm not sure. But other peripheral systems besides the nervous system that are involved include the peripheral circulation. People have had development of arterial thrombosis, which has actually caused limb loss.
I imagine also that, I mean, if the peripheral or other nerve systems are involved, you could have heart stopping, heart beating stopping because of neuronal causes, or for example breathing stopping because of peripheral neuronal involvement, nerve system involvement. Is that something that's being considered?
Again, I haven't really read anything about that. I'm not familiar with that. Heart stoppage usually has occurred because of direct effect on the conduction system.
I see.
Whether because of swelling between the cells, otherwise known as interstitial edema, or actual destruction of the conduction system by either the virus or the cytokine storm or hyperimmune response.
I think we're gonna go later back, maybe in a later episode, on talking about the effects on these other organs other than the lung. But I would like to concentrate on the lung and how we can rescue or mitigate the consequences of the virus on the lung, on the human lung. So we have observed something quite interesting. That is that SMS cells have the ability to stimulate the proliferation of alveolar type 2 cells of the lung, of the human lung. And now alveolar type 2 cells are contributing to the lung fabric, and they come in terms of surface, they occupy a small surface within the lung. Most of the lung is occupied by alveolar type 1 lung cells, and those lung cells, the alveolar type 1 cells, are responsible for the oxygen exchange, and they are essential for us being able to breathe and getting oxygen and getting rid of the carbon dioxide. So having that compromise, the alveolar type 1 cells, means that we will not be able to breathe, and this is what happens mainly when we have a viral attack. So there could be other agents also causing that that phenomenon of deterioration of alveolar type 1 cells. And when that happens, luckily we have alveolar type 2 cells that are able to regenerate alveolar type 1 cells. I'm going to call them AT1. So AT1 can be regenerated by AT2, the alveolar type 2 cells. They act like a progenitors for these cells.
So am I to understand that the AT2 cells will morph or evolve into AT1 cells? And in what way do SMS cells act on the AT2 cells?
Yeah, what we looked at very intensely is how do the AT2 cells behave in cell culture. Now, in cell culture, you need cells that grow, and you would like to see whatever affects that growth. AT2 cells do differentiate into alveolar type 1 cells, or AT1, and they also maintain their existence. So they create that in addition to alveolar type 2 cells. What we saw is kind of remarkable, is that using SMS cells, in the presence of SMS cells, there is a strong interaction between alveolar type 2 cells, these progenitor cells, and the SMS cells. And this interaction results in the stimulation of proliferation, but not under any condition. It's actually under a very especially relevant condition, and that condition is when you remove serum from the medium. So when you remove serum from the medium, you observe an enhanced and a stimulated proliferation of the progenitors' alveolar type 2 cells. And that is quite important because we understand from the discussion that during COVID-19, the tissue will be starved of blood, and blood access will be way less for the cells, and that will result in the tissue usually dying or at least unable to proliferate. So whatever provides for the proliferation in the absence of blood or serum is actually very important and relevant to COVID-19.
So you mentioned that when there is damage to the alveoli of the lungs, and specifically the AT1 cells, undergo necrosis and then require regeneration through the differentiation and proliferation of the AT2 cells. My question is, if there's poor blood supply after the AT1 cells are regenerated and replenished, how are you going to be able to apply or provide a blood supply for those cells in damaged lung? And my question is, can SMS cells also, because of their potential for stimulating angiogenesis, be part of the lung repair process in stimulating the regrowth of the capillary bed that underlies the alveoli in the lung?
Yeah, I think that's an excellent point here. We've talked in prior episodes about the angiogenic potential that extracellular matrix produced from SMS cells presents. So what we expect here is that in addition to the stimulation of the alveolar type 2 cell proliferation, we should expect a stimulation of the endothelial cells for the formation of new vessels for angiogenesis. So that is, I think, the beauty of the complexity of cells. Unlike having a specific medication that targets a specific function, cells are able, within their inherent complexity, is to orchestrate several actions that make sense within the ecosystem of the tissue. So it would make sense to stimulate these progenitor cells to, in the absence of blood. But it would make sense also to provide initial formation of microvessels that will recreate the ability of the tissue to supply to cells enough blood and nutrients. So it's really a logical system that makes sense for the survival and repair of the tissue.
An important question comes up. Previously, you had described that SMS cells have the propensity to bind to their target cells. My question is, for example, with the AT2 cells, initially there will be a binding of the SMS cells, and then they go on and differentiate into AT1 cells. Do they continue to be bound to those cells? And subsequently, if they're no longer mobile but they're sessile, at that point in time, do they begin to produce their extracellular matrix, which could then go on and stimulate angiogenesis?
Yeah, I think what we see so far from the in vitro studies is quite consistent with the fact that following binding, given enough time, there is a formation of extracellular matrix. We would like to see that process within in vivo state, within the body. It is, however, still not researched, and we can only attest to the fact that the presence of extracellular matrix within a wound, for example, does stimulate a lot of processes that relates to granulation, formation of new cells, and the capillarization. So there is a lot of work yet to be done with regard to what actually happens within the tissue, within different types of tissues. So that's quite interesting.
Yes, very.
Okay.
And it looks to me as though the lung model or lung cell model is simply one organ system in which SMS can act. And it's my impression that given the versatility and regenerative effects of SMS, likely they can provide regeneration in other damaged organ systems.
Yeah, I think that will be our topics in the next episode.
Yeah.
Now, we have spoken about the effects of the virus on different organs. I think the challenge is not just to create a solution for one organ, but maybe to address several organs. Regeneration and repair is a phenomenon that is present in many organs, and there are aspects to it that are common to many organs. So can we address this need for repair and regeneration using SMS cells? We're gonna discuss that important question in the next episode. Thank you very much, Dr. Roger.
A pleasure, Dr. Rahmo.